It's coronavirus today and 467 phase 1 day 12, and we have 296 coronavirus cases and there's some data issues like 123 cases are from Toronto, which is inaccurate, but it's 80% of those cases are from 2020 as a part of a data cleanup. 61 cases are from Waterloo Region, so Waterloo Region, they're still in top. 37 from York Region and 20 from Pure Region. All other regions reported 20, under 20 again. Number of deaths is 60 deaths have been reported. However, 54 of those deaths are from the previous months or not. It's also data cleanup, so this year. So variants. So the UK variant is at 1,142,393 plus 1,178. South African variant is at 1,154. This is the third day straight. It has not changed. It's still unchanged. The Brazilian variant is at 4,256. Class 2. And India variant, which people keep using the Delta variant nickname, which I think it doesn't really fit the name, in my opinion. That 916 plus 29 since last time. So, vaccine bookings are for 12 and up. You can pre-book shot 2 for those 12-70 up, and India variant hotspots. You can choose the vaccine and a location and a method. The time that may vary on very depending on your first vaccination. You'll need your vaccine receipt for that one. 18 and up can pre-book starting June 28th. So currently you can, still the same method, online, by phone, at the pharmacy, through local health units, and also for youth 12 to 17. You can also do it through youth and family clinics and mobile and also people can book their get their vaccine at a mobile clinic or youth not age 12 can they can do that. Let's call that special number 1-833-943-3900 or through public health units. So phase 1 rule and phase 2 and phase 3 rules are in effect. So phase 2, the earliest for any region will start from July 2nd. So but remember, it's the health unit. It's up to them to local health unit to decide, because it's a requirement. 3 weeks must pass since the start of the phase 1, which was majority of Ontario except Porcupine County, which started late because there was there was some coronavirus outbreak going on in that region, and then Porcupine Health Unit said, "No, we're delaying." So they'll most likely be one of the regions that come in enter phase 2 a bit later. So the second requirement is 70% of eligible people are getting their first coronavirus vaccine shot. And the third requirement is 20% of residents getting their second shot, which we already accomplished that. So yeah, it's just the first one. The second one, we need to accomplish. Yeah. And this means we can have outdoor gatherings up to 25 people. We can have indoor gatherings up to 5 people. So you can have indoor private gatherings of your own. However, you can still be fined for if you exceed that number. So outdoor patio seatings is up to 6. Non-essential retail places can have up to 25% capacity, the same percent capacity. Essential businesses are allowed at. Personal care places can open with masks on at all times, meaning you can finally get your hair cut. And you can have outdoor meeting and event spaces. Amusement parks are open, water parks are open, boat tours are open, county fairs are allowed to run, and sports leagues and events, cinemas and art venues all are allowed to be open. So that's good news. Good news. Now for phase 3, we have to sort of wait until 3 weeks again. So the earliest for any region it runs through well and no problems. So this would be around mid-July or the first week of August, my estimate. So 3 weeks, 80% of residents getting their first shot, and 25% of residents getting their second coronavirus shot. So many people could be in 25% because Pfizer Incorporated and Moderna Incorporated, they're sending us a mass number of vaccines. So, today's focus happens at Toronto Western Hospitals. University Health Network, the parent organization for the hospital, and they also, they're in charge of, Toronto General Hospital and Women's College Hospital and Mount Sinai Hospital, and some of the doctors who were in charge of me. They're from many doctors are from UHN, and So the problem with Toronto Western Hospital right now is they're having an outbreak, which officials are saying is the main reason could be the India variant. So in Toronto Western Hospital, in the 6A unit on Thursday, so 5 patients and 3 staff members have been affected. So a memo sent to the staff and posted on the UHN website that those who tested positive for coronavirus included people who had that were had partially vaccinated, 1 shot, or 2 vaccines fully vaccinated, but yeah. So the memo says the good news that the cases so far are mild, and the bad news is that the people have been infected even when vaccinated, and it has never been more important, even when vaccinated, to continue to follow hospital infection prevention control and public health measures. So the officials are encouraging people to get fully inoculated, fully vaccinated against the virus as soon as and they are eligible, in effort to help minimize the chance of getting hospitalized with the virus. And they're also pushed for continuing practices like wearing face covering, the physical distancing, not attending indoor gatherings, washing hands, and sanitizing, and staying home when feeling ill with any symptoms, even if they are minor. So, Toronto Public Health Unit, there's currently 1 institutional outbreak in the city, and while there were 47 coronavirus cases in Toronto reported on Monday. The current 7-day moving average of cases sits at 96. So hospitalizations sit at 8 people right now, and so when it comes to the capacity of Toronto's hospitals with the ICU bed occupancy rate is 62%, and acute bed occupancy is 83%. It's Toronto, big city, And then when it comes to the India variant, of course, that's no joke. Serious talk. So, Pure Region, Ottawa, Toronto, Pure Region's Lawrence, Toronto's Dr. Eileen Villa, And on a what? Yeah, when they went. Dr. Vera Atches, and yeah, mentioned, yep. They all mentioned all three of them, and all three of them did thought they did recommend another phase, stay at home regular rule. And of course, in Ontario, those three places, and now Waterloo Region has joined the list of highest India variant contributors, and Peel Region 97, Toronto 122, Ottawa 141 with two additional deaths. And Waterloo Region, and they were also at higher numbers than the 50s, 60s. And of course, that's the reason why the Waterloo Region and became one of the top 10 Indian variant hotspot regions in Ontario. And medical officer Hussein Lee Wang, he said, "Yep, travel was that's definitely the reason because, and that is true because someone brought it in and it kind of like affected people this kind of like happened. That's the same thing with I think it was a South African variant or someone went to like brought the South African variant over accidentally, like without knowing it, into London Middlesex region, and then some elderly man who was healthy, he got it, he quarantined, he's free, he got vaccinated, he's free, yeah. Just some stuff we're very concerned about. And let's not forget, the India variant will be the new variant that takes over as the new leading variant, danger zone. So hospitalizations, 334 people are hospitalized with the coronavirus, plus 73, not good. 314 ICU patients, minus 9, and 202 ICU patients using a ventilator. That has not changed since yesterday. Long-term care home death is still at 3,782, unchanged since yesterday. Staff death has not changed. I'm still since May 15th, still 13. Well, 9 outbreaks, unchanged since June 20th. So third day straight. So please follow coronavirus safety rules and regulations and PH1 rules. Don't have a gathering though over 10 for the safety of others now. Because the major threat, the India variant, that could like ruin our summer, and that could like delay a lot of stuff. So sign up for vaccinations, because that's also a requirement for phase 2 and phase 3. And of course, I wouldn't want to get in the India variant, because that's trouble. Not only that, the molecules that make up the India variant is way different than the UK variant, South African variant, and the Brazilian variant. So it's its own unique. So labs can find the 3, variants, but they can't. Most of them can't track the Indian variant, and that's the problem. That's an issue. Oh, stay safe. India variant cases have increased, so no. So once you're eligible, please register, prebook for your earlier second vaccine shot.